Good morning, everyone. Joe Roble, once again, back with Northwest Indiana's top-rated chiropractor, Dr. Newhaven. Today, Dr. Newhaven is going to discuss if you're at risk for an ACL injury. Good morning, Doctor.
Morning, Joe. Thanks.
Tell the great people in the world, give them a little bit about your knowledge about ACL.
So for those of you who don't know what the ACL is, it stands for the anterior cruciate ligament, which is one of the main ligaments stabilizing your knee. So it's the one in the pro athletes where you see that the knee just looks like it kind of slides a little too far forward, and it keeps people out for seasons at a time. Derrick Rose is one of the famous people who suffered an ACL injury. I believe it was on his left knee. Willis McGahee suffered a really bad looking ACL injury. I myself actually have had an ACL replacement. So when I talk to you guys about what to look for in an ACL injury, know that it's coming from a place of experience, and it's something that I take very personally because I've had ACL surgery, and I don't want you guys to have to go through that. So.
Cool. So would you like to show them your knee or show them proper ways to...
Yeah, you know what? So when you guys see, I should have wore shorts today, so my office is not flooded. You need to have good visualization of my feet and my knees because, ACL injuries, and I'll get down so you can see me a little bit. ACL injuries, a lot of it has to do with your mechanics. So, are you, when you're making a cut on the soccer field or when you're going for a run, is your body doing the right things, or are you putting potential stress and tension on that ACL where eventually it could rip and tear? And so one of the most important things for all, as a predictor for any kind of future athletic injury is the ability to dorsiflex the ankle, or how much bend can you get here. So if you see right here, folks, it's pretty nice and neutral here. And so when I bend, this angle here is called the amount of ankle dorsiflexion you have. And so when you get an ankle sprain, a lot of times what happens is the ankle tightens up and you lose the ability to create more of an angle here. And so anytime you run, you jump, you walk, you need good motion here. And so when you don't have good dorsiflexion in the ankle, it puts you at a real high risk for especially an ACL injury and potentially other types of injuries to the body. And so, essentially, ideally what you want is at least a good 10 to 15 degrees here of dorsiflexion, and you want it active. So active means like when I'm standing and I do a squat or I lean on this, like how much bend can I actively get in that ankle if I try? And so that is one of the most important things to look for future potential injuries, especially of the ACL. A second thing that you can do that we won't go through it today, but I'll discuss briefly for you, is to check for hypermobility. Hypermobility is too much motion in certain joints of the body. And so the population with the highest risk for an ACL tear is, and this is proven through the research, is high school female soccer players. And one of the reasons that particular population has the highest rate of ACL tears is because often they're hypermobile and they have too much motion in, for instance, their knee. And so we've all seen different people who are essentially like what we call double jointed in the elbow. I'm not one of those people, but where the middle part of the ankle can kind of extend up a little too high. The same thing can happen in the knees and the legs. So you're people that can just go all the way to the ground and touch their hands and maybe even their elbows because they have too much motion in the knee. And so what happens is it almost looks like a reverse C where the knee actually bends too much backwards. And so that indicates hypermobility in the knee and can really put a lot of stress on that ACL. And there's a great hypermobility test out there called the Baton test, and Baton is spelled Beighton. And there are essentially 9 tests, I believe, and depending on how you score, it will give you an idea if you're hypermobile or not. And specifically, in the knees. So, for those of you that are hypermobile, that automatically puts you at a little bit of an increased risk for things like an ACL tear. But especially if you're really hypermobile and you lack some dorsiflexion, that definitely puts you at a different level for potential risk of ACL injury. One of the last things I'm going to talk about is, what the foot and the knee do. And so, for those of you who are flat-footed, that's another thing that will put you at risk for an ACL tear. So if you watch what my foot does, so right now it's nice and neutral, if you want to watch this foot. And so if you are flat-footed, watch what the knee does. So you see how the knee kind of bends inward a little bit? So imagine now that, say I'm a soccer player, and I'm flat-footed, and now I want to make a cut on the soccer field. Well, your knee is already torqued and twisted and bent in. So now when you make that cut, you're preloading the ACL and some of the meniscus and some of the other structures in the knee where you're putting yourself at risk for an injury there. And one of the last things is a lot of times either because of foot structure or because of the way that your hip is, a lot of times when you move, for instance, when you do a one-legged squat, watch what my knee does. So here it stays nice and straight, a little wobbly there, but what you want to look for is anybody where when you squat, the first thing that happens is this, the knee comes in. So that's called genu valgus, or inward bowing of the knee. And so, so anytime you're going upstairs or you're making a cut, all that is essentially on one leg. And if the first thing that happens is your knee dives in, and you make a cut or you're going up for a jump, that knee diving in also preloads the ACL. And so that will put you at increased risk. So imagine now that I am hypermobile, I have too much motion in my knee, my foot is flat, my knee is already diving in, that type of a person is at a really high risk for an ACL tear, really high. And a lot of times you will see this very, very commonly, young high school female athletes, but this is a lot of times you see this in your population. You see it in a lot of other people as well, but that is just one of the the highest populations you see it in because of the way they're built. And so this is most of this stuff is correctable with the right kind of treatment. It's not something that you can essentially be trained on your own. You need a professional, whether it's a physician such as myself. Sometimes, if you find a good trainer, they can work with you on it. But there are a lot of ACL prevention programs out there. Some are better than others. But what you want is these are things that you can look for initially to say, is my child or am I at a little higher risk than I care to be in? And if so, if you see any of these things, I would definitely recommend getting a more thorough evaluation by someone such as myself, so that you can, say, hey, let's work on this and do our best to prevent an ACL injury, because ACL injuries can be life-changing. Nowadays the surgeries are great, and a lot of times the therapies can be very good where it's not, but it can sometimes take a very promising athlete and just change the course and the direction of where they're heading. And even for you regular folks out there, it can just alter the way that you function for the rest of your life. And I don't want that for you guys.
As a side note, Dr. Bob's actually published for his speedy recovery after his ACL surgery. They were astounded by his, I guess you had a great group of physical therapists. And
yeah, so when I went through my ACL surgery and my recovery, I was back running and playing basketball again in under 3 months. And a lot of that has to do with the type of surgery they did, and then definitely with my therapy. I received really great therapy, and that's one of the main reasons why I got better so much faster. And they thought it was so fast that the people who did the therapy ended up getting an article published about the different therapies that they used on me, because what was used was a combination of chiropractic, of different kind of soft tissue and massage techniques, good physical therapy and rehab, just a plethora of treatments, because that's what gets the best results, is when you kind of combine everything together and then you tailor a program to that individual. And that's the therapy I got, and I was just very, very lucky to have some great therapists working on me, and my body participated in that recovery. So
responded quite well.
Yeah.
Well, you know, another thing too, I know a lot of older people have problems with knees. My mom being one of them. You know, you get older, maybe overweight. I don't know if that's always the ACL injury, but you know, it's such a common thing, and I'm sure great people here were educated. Did a fantastic demonstration, and appreciate your time.
Yeah, and just a little quick on that note is, you know, things I showed you. I was gearing this video a little bit more towards ACL, but all these things can potentially create just generalized knee pain, increased arthritis, meniscal issues, so the cartilage. So a lot of you people who have had meniscus surgery, these are things that you can also look for because you're preloading or putting too much load on that meniscus as well. And you know, so these people with knee pain, you know, all this stuff can be applied to you individually. And I see it all the time in my patients with knee replacements or bilateral knee replacements is, you know, they've done the replacements, but a lot of times still they're functioning and they're doing a lot of these bad things that continue to create pain in their knees. So it absolutely, a lot of times, is fixable, folks, if you find, you know, a good therapist that's going to work with you on these things and get you to correct them.
Fantastic. Well, there you have it. Thanks to the top-rated chiropractor in Northwest Indiana, Dr. Newhaven. If you have any questions or would you like, you know, just want to give him a call or want to set up a visit, you could call his office. We've got an office in Schererville and Crown Point, 219-322-6942, or visit his website at nwchiropractic.com. Thanks again. It's always educational and a pleasure.
Thanks, Joe. Thanks, folks. Be safe out there.